5 signs that death is near. Hello, this is Soul Talk English. In life, every meeting inevitably comes with a goodbye at some point. While this is an obvious truth, farewells are always a sad reality. The grief of losing a loved one is especially hard to bear, and the sorrow of never being able to see them again brings even more pain. It would be wonderful if our loved ones could always stay by our side, but helping those who are suffering to pass peacefully can be a wise approach. So I decided to look into it. I was curious about what symptoms we experience before death, and whether there are any pre-death signs that change in stages. Signs indicating approaching death, decline in physical functioning. Patients nearing the end of life show extreme weakness, unable to get out of bed or even change position without assistance. Swallowing becomes difficult, leading to a liquid-based diet. They may exhibit signs of dehydration before death, feeling comfortable in a slightly dehydrated state. Increased sleep time. As death approaches, patients sleep longer and become unresponsive even when spoken to. They may fail to recognize family members and lose track of time and place. Diminished consciousness and delirium. Patients may suddenly utter strange words and exhibit unfounded feelings of fear. While they may not always be unresponsive, moments of clarity before falling into a state of confusion or coma are possible. It's advisable to prepare any desired messages while the patient is lucid. Circulatory dysfunction. As death nears, the extremities become cold and pale, displaying a dark purplish hue. The skin loses its luster, becoming cold, dry, and altering in texture. The heartbeat may become rapid, irregular, and weak as vital signs fluctuate in an attempt to preserve the final breath. Unstable breathing. Even during moments of calm, breathing becomes irregular. Chains of breaths, characterized by groaning sounds and difficulty breathing as if snoring, may occur. These are followed by periods of apnea, before resuming with deep, progressively shallower breaths. Increased secretions. As a pre-death symptom, thick secretions accumulate in the mouth and may lead to severe postural drainage, causing audible rattling sounds. Using a humidifier can help prevent dryness. It's also advisable to position the patient on their side to allow secretions to drain and to use cotton swabs or a soft toothbrush for oral care. Bowel and bladder incontinence. As death approaches, the patient's urine becomes darker and less in quantity. As all muscles gradually relax, regardless of the patient's will, sphincter muscles lose control, leading to bowel and bladder incontinence. As death nears, the pupils dilate. Once muscles relax, breathing ceases, and the heart stops, everything comes to an end. The stages of dying are not difficult or painful. Instead, as sensation fades, comfort prevails. Symptoms appearing a week before death. Loss of appetite and thirst. Increased sleeping hours. Sleeping continuously for 3 to 4 days, briefly recognizing family members' faces, then falling into deep sleep again. Body comfort. Increases, pain decreases, nausea subsides, and coughing stops. Preparing gifts for loved ones. Suddenly becoming energetic, sharing memories or compliments with family. Symptoms appearing within 48 hours. Changes in heart rate and blood pressure are common. While establishing a clear cause-effect relationship is challenging, when symptoms such as difficulty breathing, decreased blood pressure, and sudden drop in oxygen saturation begin, it often indicates impending death within 48 hours unless special medical interventions are taken. To elaborate on the changes in breathing, it varies from person to person. Some may breathe rapidly, while others may struggle to breathe. However, a common breathing pattern is called Cheyne-Stokes breathing, which can be observed within 48 hours before death. This type of breathing involves periods of rapid, deep breaths, followed by periods of shallow breathing or apnea, where breathing stops momentarily, repeating in a cycle. Additionally, as bodily functions decline before death, the inability to manage oral secretions properly can result in a rattling sound like boiling phlegm. This Cheyne-Stokes breathing pattern typically accompanies a coma or unconscious state. The third characteristic is a clouding of consciousness and delirium. Delirium is a common condition often seen in severe or critically ill patients and is one of the common symptoms before death. It may involve unexplained phenomena such as decreased attention span and hallucinations as seen in movies. According to a paper published in the Journal of Korean Academy of Family Medicine titled Occurrence of Delirium Before Death in Terminal Cancer Patients, the average period from delirium to death is 13.3 days. Delirium occurred in 51.2% of patients 10 days before death, and in 87.8% of patients 3 days before death. This means that if delirium occurs in someone diagnosed with terminal cancer, or in an elderly person nearing the end of life, they may have around 10 days left. The fourth characteristic is bowel and bladder incontinence. In fact, several days before death, swallowing food becomes difficult. Even if no food is ingested, bodily contents are released as the body's muscles relax, causing both urine and feces to leak out. Just before death, metabolism slows down drastically, resulting in little to no urine or feces output, and occasionally bloody urine. The fifth characteristic is changes in skin color. This is another change in the body right before death. Poor blood circulation can cause distant parts of the body to turn pale first, such as the hands, feet, and face. The skin becomes pale, cold, and icy to the touch. As the process advances, a bluish discoloration called cyanosis starts appearing on the skin. If your beloved family members reach an age where these symptoms start appearing, it's best to prepare in advance and share the burden of sadness, even if it's just a little. Living a long life is indeed a blessing, but it seems that true blessing lies in being able to live long and healthy. Perhaps death is another beginning, bidding farewell to this life and embracing another splendid life in the next.